What's up, guys? My name is Dr. Chris McKenzie, board certified sports and orthopedic physical therapist for players in Major League Baseball, minor leagues, the NCAA, and youth baseball. In part one of this video, I'm going to tell you why rotator cuff tendonitis occurs so you can continue to throw hard all season long if you avoid it. Rotator cuff, rotary cuff, I've heard many names over the years. It's called a rotator cuff, and if it gets irritated, it can cause you weeks on the bench. As you may have gathered, the rotator cuff is responsible for rotating your shoulder, but its significance to a baseball player like yourself is much more crucial. The rotator cuff is made up of 4 muscles, 3 on the back of the shoulder and 1 on the front. As a baseball player, when you get rotator cuff tendonitis, the tendons of those muscles become irritated because there is too much force going through them. You will usually get pain down the front, side, or even back of your arm, and in severe cases, the pain can cross your elbow and go into your wrist and hand. Okay, so what's the culprit? It's usually from one or a combination of 3 things. Number 1, overuse. Not giving your body enough time to rest between bouts of exercise or throwing. Simply put, if you are eating garbage for fuel and not getting enough sleep or rest, your body doesn't have anything to pull from to help power you in your next game or practice. You end up exerting yourself more, maybe without even feeling like you are, and this is precisely when injuries occur. Number 2, decreased internal rotation range of motion, or GIRD, at the shoulder. The back portion of the rotator cuff has to lengthen itself around the humerus as your arm powers forward during a throw. If you lack the flexibility in your rotator cuff muscles or in your joint capsule, these tendons have to stretch beyond the range that they are comfortable in. As you might be able to imagine, when you stretch something beyond its limit over and over again under high loads, it's going to hurt. And number 3, poor eccentric strength and power production. It's no secret that most baseball strength training programs out there make you strength train the rotator cuff muscles to work concentrically, a muscle shortening action. Now, during a pitch, the rotator cuff works eccentrically, meaning the muscles are actively lengthening while they're still contracting. Another way to think about this is that your arm is being thrown forward towards the plate, getting pulled away from the socket. Your rotator cuff is then working to pull your arm back into the socket. So if you lack eccentric strength, you are further prolonging your pain and setting yourself up for even more problematic injuries in the future. And a special 4th reason why rotator cuff tendonitis occurs in you older athletes out there could be because you have a hooked or curved shape underside of your acromion. It's the bone right at the tip of your shoulder. Now, this bone can dig into and scrape your tendons, causing irritation and all that non-fun stuff. Now, only surgery can fix that issue, and that's a discussion for another time. Okay, now we know why rotator cuff tendonitis occurs in the baseball player. Next week, in part 2 of this video series, I'm going to show you exactly what you should be doing to get rid of and prevent rotator cuff tendonitis from happening again. So leave a comment below and let me know what you think about this. And if you know someone who would benefit from hearing this, please share it with them. Do you want to know the secret to preventing baseball elbow pain? Then click here and download my free report, the #1 exercise to prevent baseball elbow pain before it starts, and get rid of it if you have it, that you can use immediately.